So number one methodological approach is descriptive or survey method. So descriptive epidemiology is the first phase of epidemiological investigation, which is concerned with observing and documenting the distribution of disease in human population. So it answers the foundational questions of who is affected, um, where and when, without attempting to explain why the disease occurs. Now we are going into detail in descriptive method. So we already know that what does it states, yeah, what does it answers? It answers the questions to who, where, and when, right? And we are using the observational methods to study the disease in terms of person, place, and time. So person, it's answering who is being affected, place means where, and time means when. So these three dimensions help us to identify the pattern, trend, and potential risk groups for the particular disease. If we come to person, person means socio-demographic characteristic of an individual. Socio-demographic characteristic means the individual is means what data are we collecting for an individual, like his age, his gender, his ethnicity, occupation, socio-economic status, lifestyle factors. So in this way, we are able to understand and identify the vulnerable population, and we can tailor the interventions accordingly. When we are talking of a place, we are examining the geographical and environmental context of the disease occurrence. So, whether the disease is occurring in urban area or a rural setting, specific cities, district or countries, what does the trend says, the clustering of cases in particular locations, and environmental exposures, like what are the water resources, what are the housing conditions of people living there. So this helps to detect spatial pattern such as localized outbreak or regional disparities. Then we talk of time. Time dimension explores the temporal trends, means time trends in the occurrence of disease. Means, are there any point source epidemic? Means sudden outbreak from a single source. Secular trend means long-term changes over years or decades. Seasonal variations means fluctuations based on climate or behavior. Temporal clustering means periods of increased incidence. So the time trends gives us the answers to all these four factors. Then what are the objectives of this type of study? The objectives we have, like it is used to describe the health status of the population. It identifies the high risk groups, vulnerable population, monitor the trends over time, generate hypothesis for further study, support public health planning and policy, and evaluate health services and programs. So these are certain objectives of having this descriptive epidemiological study. Now purpose, it is just similar to our objective. Purpose is that we are able to map disease distribution. We can generate the hypothesis. We can we are able to inform the surveillance and early detection authorities. We can guide over resource allocation, and we can also support in health policy and planning to the authorities. Now, what are the different types of descriptive methods? We had studied before that case reports, case series, cross-sectional studies, ecological studies, surveillance system. These are four types of descriptive methods that are used in this type of epidemiological study. Now, what are case reports and case series? Case report and case series both are very simple form. Like they provide detailed documentation of individual or group clinical cases. They highlight unusual presentations, rare diseases, and emerging health threats to the community. So, case reports are used to document rare and novel conditions, identify new side effects or complications, unusual disease patterns, generate early hypotheses, and alert the public health authorities to the emerging threats. So, this is the use and purpose of having the case reports and case series into notification. Now, if we talk of a typical structure of a case report, so we should have the demographic of a patient, clinical presentation, what are the diagnostic findings, what is the treatment given to him, what is the outcome, what is the follow up, and if there is any novelty in this case, that should also be written in the case report. So, what are the strengths and limitations? Strength is that we can early detect the case. We can highlight the clinical observations in particular individual, and it is often the first step in identifying new cases. So, what is a limitation? Limitation means it is a selection bias. We do not have a particular group or a particular person like we are talking of, right? So these are certain strengths and limitations of this type of study. Then we come to cross-sectional studies. Cross-sectional study is observational study that analyzes the data from population at one specific point of time. One point of time means not over a period of time, only a one point of time means a particular month or a particular seasonal change, right? So purpose is again to estimate the prevalence, identify the association between exposure and outcome, describe the health behavior of people, and support resource allocation and policy formulation. So what are the characteristics of this survey method? We can say that it is a population based sampling because we are representing a defined population and using random or stratified sampling to ensure generalizability. Then standardized data collection is there because we are using such instruments like questionnaire designs, checklist, digital forms to ensure consistency across respondents. Then we are also having the snapshot in time, like that data is collected at a single point of time. Then quantitative focus means the prevalence rate, the frequency counts, all we have in the numerical form, right? Then self-reported and observed data both are considered in this method. Then ethical considerations are we require informed consent. We have to keep the data confidentiality, and we have to also see the cultural sensitivity of the people who are being examined. So if we are planning a cross-sectional survey, this is certain steps that we have to see. Like we have to define the objectives, we have to define the target population, we have to select the sampling method, what it should be like random, stratified or clustered. Data collection tool has to be designed. We have to train or we have to train the field investigators. We have to do the pilot test of the survey. We have to collect and manage the data, analyze the results, then interpret the findings. So merits are, it is a quick and cost effective method, useful for estimating burden of disease, can study multiple outcomes and exposures, and it may support health system planning. So if we talk of use in public health, we have national health surveys done at periodical time period. So this helps a lot in policy formulation, right? Then ecological studies, these are again the descriptive method, but it is examining the relationship between exposure and disease at the population or a group level, right? So ecological study is observational study in which units of analysis are populations or groups of people rather than individuals. So ecological studies are uh, we are studying the disease at the population level, right? So purpose is to explore the association between group level and outcomes, identify the geographical trends, generate hypotheses, and inform policy decision makers. Next, we come to surveillance systems. So surveillance is a cornerstone of public health practice, and it involves ongoing and systematic collection, analysis, interpretation, and dissemination of health data for the purpose of planning, implementing and evaluating public health interventions. So, according to WHO, it is the continuous systematic collection, analysis, and interpretation of health related data needed for planning, implementation, and evaluation of public health practice. So quickly we'll come to types of surveillance system. We have passive, we have active, sentinel, syndromic, and ICD, like integrated disease surveillance system also. So passive, if we talk of, it relies on routine reporting from healthcare providers. Active surveillance, health authorities actively seek out cases during the outbreaks. Sentinel surveillance, selected institutional report high quality data on specific conditions. Syndromic means we are tracking the symptoms before the diagnosis is there to detect the early signals of the disease. What does this IDSP says? Integrated Disease Surveillance System. It combines multiple data sources for comprehensive monitoring. So this IDSP is a national integrated disease surveillance program for epidemic prone diseases that is happening in our country. The number two or second one you can say is CDC's National Notifiable Disease Surveillance System, that is NNDSS. Next one is WHO's Global Influenza Surveillance and Response System, where we are particularly tracking the influenza cases. Next is the polio surveillance, where we are using stool samples to see that polio is still existing or not. So if we talk of uses, then yes, it monitors the communicable diseases, track non-communicable conditions, evaluate vaccination coverage, and support health emergency preparedness in the country. Now, what are the steps involved in descriptive studies? So steps are like we have to define population, we have to define the disease under study, describe the disease in terms of place, time, and person, measure the disease, and formulate the hypothesis. So these are 5 steps involved in descriptive studies. So you study this, have a look on these steps. I'm coming to uses of descriptive epidemiology. So key uses of descriptive epidemiology are like disease surveillance and monitoring, identifying high risk population, health service planning, policy formulation and evaluation, hypothesis generation, comparative analysis across regions or time periods, and then community health assessments.